Hi, hello, my name's Andrew Picken, Royal Wellness at Chesterfield Royal Hospital, and this morning I've got Dr. Fauzia Begum, Occupational Health Doctor at UHDBT. Hello.
Hello, good morning.
And today it'll be an interesting topic. I think we're going to cover a hot topic, I think, in terms of long COVID and its effects. And I think in particular with our staff right across the ICS in Derbyshire, and I know you're doing a lot of work. So first of all, I suppose the question, what is long COVID? Because it seems to be sort of quite a collection of different symptoms are affecting people differently. So what are you seeing in terms of long COVID symptoms?
Okay, so in terms of what the definition of long COVID is, NICE, the National Institute of Clinical Excellence, are saying that it's any condition that is symptoms that are going on beyond 4 weeks of having a diagnosis of COVID.
So that is the definition. And in real terms, when dealing with people, what are you seeing? Because I guess from my limited experience, and you'll be able to tell me a lot better, you know, I'm hearing lots of different ways that it's affecting people, from fatigue to brain fog to physical symptoms of being out of breath and things like that.
So they're all the symptoms that you describe and more, really. So the predominant symptoms that we're seeing is in terms of mental health side of things, we're seeing brain fog, memory difficulties, difficulty concentrating and focusing. And in terms of the physical symptoms, what we're seeing is breathlessness, persistent cough, fatigue, and really generalised tiredness and achiness seems to be the predominant symptoms coming through to our service.
So in terms of that, though, the effects on staff, so staff working shifts, and I've heard things where staff have felt all right one shift and then the next day they've just been completely wiped off the feet. You know, it's been one of them. It's quite unpredictable. I guess there's no time scale to the length of long COVID, is there? It differs for different people, or it's evolving because it's a research area in itself.
Yeah, so what we're saying is that staff who are already back at work following their long COVID diagnosis, or indeed having some time off after COVID positive result, we would recommend that they get in touch with their local occupational health service so that they can plan a return to work that would facilitate what you're describing, where one day they will have lots more energy and one day they may have less. And if we can get that right, then we're in for a better chance for getting them in work longer.
Yeah, and as we know, obviously, returning back to work rather than a long absence is beneficial for the health and well-being of the staff member anyway, so the quicker we can facilitate that. So these are terms of managing it, so working with occupational health to make reasonable adjustments around catering for those sort of symptoms with staff. And then in terms of the mental health aspects, that's the big one, isn't it? You know, I mean, we have a small group at Chesterfield of staff that have really said it's caused them a lot of anxiety of what's going to come next, with a fear of pending death. Maybe with some staff members have said that to me, and just that general anxiety that it brings on. What are you seeing in terms of the referral service that you've got, in terms of staff coming in with those sort of symptoms and the support you've got? So
through the long COVID service, what we're finding is people who have previously had mental health issues before contracting COVID, they're predominantly presenting with depression, anxiety, and conditions sort of having exacerbated by their diagnosis. What we're also seeing is people who never had mental health conditions in the past, or mental health concerns in the past, they are now presenting with adjustment disorders. And to be honest, what I would say to anyone listening to this talk is that a little bit of an adjustment disorder is something that we would expect. I mean, what your life was like before COVID and before a diagnosis of long COVID perhaps may well be very different to what it looks like now. And having a space to sort of breathe and talk about that change and how quick you were expecting to improve in your symptoms, but now are finding yourself in a position where it's not as quick as you'd hoped it'd be. These are all things that do need support from a mental health perspective, and what we offer through the service is support in conjunction with Trent PTS. And what we do is offer self-help support for those who aren't ready to engage with one-to-one counselling or one-to-one therapy. And then we do have one-to-one therapy and sort of step 3 level higher support when that's needed. And also what we're doing is a 4-week course called Coping with COVID. That is a psychoeducational course, and really it's about looking at the different aspects from a mental health perspective that one may be affected by COVID, and how you would manage each of these areas, and just giving you the coping mechanisms to get you through this part of your life, really.
And I think that's probably, you know, looking at long COVID, it's a relatively new area. There isn't a cure. We just had a conversation now before this recording, but what we can lean on is those evidence-based things that do work in any long-term condition or adjustment phase to different things that affect us. So menopause, for example, you know, that I know shares some of those symptoms, but just bringing people together so that they're not isolated and sharing some of those symptoms. That goes for any condition. So we are relying on trusted and tried methodology, but we're mixing it and making it very relevant to long COVID, aren't we? So in terms of the service, so we're quite looking. I think it's fantastic to have you on board as well, really running this for us. Across Derbyshire, we are in this sort of pilot phase where there's some funding and you've got specific time to run this service for us. So somebody's, you know, had COVID, they feel as though they're experiencing these symptoms ongoing way beyond the initial infection. How do they access the service and what sort of support will they get?
Sure. So how we access the long COVID service, and then, you know, I should add that the service is open to anyone who is working in the NHS or health and social care sector across the county. What we do is have a referral form. It's very simple, and you complete it and send it over to uhdb.longcovidsupport@nhs.net. And what we, if you can't find one of these referral forms, then just email us and we'll send one over to you as well. So that's an easier way to access. But at this point in time, I think it's on everybody's intranets across the county. What you would expect is from the initial point when you make that referral, when we get that referral, we make an initial appointment with a wellbeing practitioner who sort of talks to you about what needs you have and sort of what needs have been identified in your referral form, and what service we can plug you into from that point onwards. And so far we've had over 120 referrals through to the service, and the service launched in September this couple of months ago, and feedback has been positive so far, so we're in a good position, I think.
Yeah, no, I think it is as well. I think it's a great example of collaboration as well across the system. You know, it's great to have you guys involved, and I've learned some stuff when we've met previously as well in terms of your service and stuff. So we thought we'd do this video really to track somebody's journey once they've referred themselves in, and I think that might just allay some fears with some people as well, that actually accessing any sort of service, whether it's mental health, long COVID, etc., can be a bit scary. So I think people watching this video are looking to cost. So that's what happens. They've seen yourself, they know you run the service, and you're a real person, and you know, and it just helps, doesn't it, sometimes allay those fears. So what do you expect? It's a difficult question, this, but I'm going to ask it anyway, I suppose. We haven't rehearsed this as well as it's important to say most of that videos we do. Just go off the cuff. There's no script, no questions. We just thought we'd go for it. So how do you see long? It's a difficult one, this, because even the experts can't predict it really. How do you see long COVID in the future going on? I mean, do we get anything from ME and other chronic fatigue you know, conditions that we can sort of predict where long COVID's going to go, or do you think it is going to be a long-term management in terms of staff and having those resources to help facilitate that to get us out the other side?
So I think using chronic fatigue and ME as a way to look at long COVID is something I would also look at. You know, that's the way I look at it as well in terms of managing these people in the workplace. I mean, if they're you know, some of these symptoms are going on for some time, and then we do need to start thinking about longer term reasonable adjustments within the workplace, because a lot of these people that I meet are very motivated to return to work. They're just struggling at this point in time with their symptoms, and so what we need to do is help them return. In terms of looking at it from a sort of chronic fatigue condition perspective, what I would say is that like lots of chronic fatigue conditions, the long COVID takes a bit of a boom and bust sort of model, and where there are days where you have some more energy and there are times when you do take a bit of a dip, and some of these dips take a little bit longer to come out of than others. And what we need to do is support our colleagues in identifying what things may trigger a dip, what things may benefit them in coming out of these dips, and how we can manage their condition overall. And I think it's a lot of things that I'm finding on my Tuesday mornings. So one thing I think I might just plug in there is on Tuesday mornings, I run in a sort of a virtual peer support group at 9:30 over MS Teams, and I'm sure Andy can send you the link for anyone who's interested in that. But what I do say on that is that we need to help everyone identify what their triggers are for a dip, and what things help them. And actually having a peer support model has been really beneficial, because there are things that some of our colleagues have tried and others find beneficial. So that's the kind of sort of safe space that I want to create to go through these symptoms really together.
Keep plugging away. That's what this video is about. I think also, you're not selling anything here, I suppose. No. And then I think wrapped around that, we've got a lot of resources across the system, haven't we, in terms of Thrive, in terms of managing anxiety, the app, the deep muscle relaxation, all that sort of coping mechanism stuff. And then we've got the EAP around that as well. And then for some, when entirely appropriate, we have got, lower level physical activity sessions. I know UHDP have got the same, and DCHS and the various partners. So there's a lot of wraparound stuff as well to help ease people in that transition back into those sort of activities that they may have enjoyed before.
And I think that's the beauty, one of the beauties of working in an NHS trust in Derbyshire. We've all got wellbeing leads in our trusts, and I think what we want to be doing is sort of most of our trusts have wellbeing activity planners, and there are things like mindfulness and meditation that are on those planners and timetables. And I think if we can get plugged into those, and if our colleagues can engage with classes that help with your breathing, and because we're finding breathing dysregulation, once that's sort of improving a little bit more, then all the other symptoms start to improve as well, because some of anxiety is related to the struggle to breathe as they used to. And so once we can get on top of these, then overall management is just more successful, really.
Yeah, and just picking up on a point you said then, it's sort of looking at, you might be breathing, or the capacity to breathe is different from previously, but it isn't a problem in terms of you're going to stop breathing, but it's just different to what it was. It's making that definition into it and that adjustment to it as well. But I suppose this video has shown us there's hope out there. There's another side out there, and it's about sort of managing these symptoms for however long they last, and they could subside, and they certainly will with all the different help and mechanisms we've got in place. But not to discount that this support pathway in place. You manage that. There's the Tuesday group. You've got all these various things, so people have got that next step up, and you're not alone with it. You're not isolating. You should be isolated. You've already had 100 and odd referrals, haven't you? So there's other people out there that will be experiencing it, and part of sort of the recovery process is listening to other people, so you're not alone with it. Key point.
Yeah, no, thank you for that. And I think what I would say is that I work very closely with the Long COVID Community Service that is run from DCHS, and what we have found is that sort of leaning on each other in terms of the sort of symptoms and presentations that we're getting has helped to develop both of our services in a way that we can provide the best we can for our staff. In terms of the fatigue side, and something that I didn't really touch on before, is after you've had a wellbeing caller sort of conversation, then if you're presenting with physical symptoms and would like some physical support, then what we're doing is fatigue management classes, and these come in grades of 4 within the service. And when you're very much struggling, then we'll put you into class 1, and sort of nearly returning to work, we'll put you into class 4. And these are sort of 4 weekly sessions. And at the end of that session, you can then sort of graduate into group 2 or group 3 and keep going until you're at a stage where physical support is what you need it to be, really. And I think fatigue management wise, we've got the chronic fatigue service at UHDB, and we're working closely with them, and they've got videos that we are sort of sharing through the service that may be of benefit to others as well.
So to me, I mean, I'm feeling positive already. I think there's a, I think it's a really good service. I think it's needed, and I think, to be honest, I think it'll generate its own referrals for people that are unfortunate enough to experience long COVID afterwards. That actually in Derbyshire we have got that support right across the system, and people can access it easily as well. And I think that's a key to it as well. It's an easily accessible service. You're not having to go through your GP to get referred. It's a self-referral, and that in itself removes a lot of barriers. So thank you very much for your time. Great luck with the service as well. I think it's really well needed. I'll put on the links and I'll share your leaflet on the end of this video as well, so people can get in contact with the service. And of course, I'll put some details about the group that you run on Tuesdays, your plug, if you like, so people know about that.
It's absolutely fine. Thank you. And as Andy says, it's meant to be an accessible service. So if you're struggling elsewhere with symptoms of COVID going on beyond 4 weeks, then please just get in touch and we'll see what we can do for you. That's
fantastic. Thank you very much for your time anyway.
Take care.